You've got hair loss and you're wondering if minoxidil is right for you. I'm a hair restoration expert and I have all your answers. So stay tuned because in this video, we're going to go through everything you need to know about minoxidil. Don't forget to stay tuned right to the end because that's where I'm going to give you a random hair tip. And now let's go to the video. Minoxidil's been around for a long time. It was actually first developed as a blood pressure medication to be taken orally. It didn't work that great as a blood pressure medication, but what researchers and scientists did notice was that people who took that medication grew more hair, and sometimes they actually grew hair in places where they didn't want hair. It was later reformulated as a topical medication to be applied to thinning hair, where it was shown to regrow hair and, of course, help you preserve the hair you still have. At its core, minoxidil is one of the evidence-based options. I like to call it one of the pillars of hair preservation and hair restoration. So minoxidil can be used in a couple of ways. In some instances, we use it to help people keep the hair that they still have. And in other instances, we use it to help people regrow some of the hair that they've previously lost. It works about 85 to 90% of the time in terms of preserving the hair you have. It works about 50% of the time in terms of regrowing hair. Now, the people who get the most regrowth are people who are the closest to the onset of their hair loss. So if you lost your hair 30 years ago, minoxidil is not likely to regrow that hair. But if you lost your hair more recently, say within the last 5-10 years, and you've still got some of that small, thin, miniaturized hair on your head, minoxidil used alone has about a 50-50 chance of adding some density back to your hair. Mostly it works on the crown area. That's the area right at the back of your head there, although it can work in some areas in advance of that. It won't regrow your hairline, for example. You use topical minoxidil by basically applying it to your scalp. I tell people just to apply it everywhere, both to the places where you've got thinning and places where you don't have thinning to help keep that hair. There are various formulations of minoxidil. For example, you can get an over-the-counter formula at most pharmacies that ranges from 2% to 5%. Generally speaking, the 2% formula is meant for women and 5% formula is meant for men. These are meant to be used twice a day. You can also access higher strength formulas directly from a physician. These might range anywhere from 8% to 15% or more. The main advantage of these is that they're meant to be used once a day rather than twice a day. We don't know for sure, but we think it works by dilating blood vessels, and that's the way it works to lower blood pressure. So we think that as blood vessels in the scalp are dilated or open up, the follicles get more blood and they're more likely to stay in a growing phase or an anagen phase for a longer period of time rather than being in a dormancy or a falling out phase. In other words, rather than being in a catagen or telogen phase. So the effect is that if more of your hairs are in a growing phase for a longer period of time, it looks like you have more thicker hair. And that's what minoxidil does. Side effects with minoxidil are pretty uncommon, and they're actually not so much related to the minoxidil itself, but rather the alcohol solution that the minoxidil is based in, that it's floating around in. The most common side effect that I tend to see, and one of the most common side effects that's reported, is something as simple as scalp irritation. So that alcohol can have a drying, irritating effect on the scalp. Sometimes all you need to do is take a day off of your minoxidil for this to go away, and maybe use your minoxidil 4 or 5 times a week rather than 7 days a week. Like I said, minoxidil was originally developed as a blood pressure medication. So in some people who use too much or absorb too much of the medication, that can drop their blood pressure a little bit. And what happens is your heart starts beating faster in response to get that blood pressure up. And some people perceive that as heart palpitations or an uncomfortable feeling in the chest. People often ask me if you can use minoxidil in conjunction with a hair transplant. And the answer is absolutely yes, because minoxidil helps you keep the hair you have. And when you've gone to all the trouble of having a hair transplant, you also don't want to lose any more hair. Minoxidil can also thicken up some hair in areas that might not have been transplanted, so that the overall effect of your hair transplant is optimized relative to not using minoxidil. Most of my patients are on it after their transplants. You can also use minoxidil in conjunction with other non-surgical hair preservation and hair restoration options like finasteride, low-level laser therapy, and even PRP. So, long story short, if you've got hair loss and you want to preserve the hair you still have, or if you even want to try to reverse some of the thinning that you've had over the last 5 to 10 years, minoxidil can be a really good, safe, effective option for you. If you like this content and you want to see more and you want other people to see more of it, hit that like button. That's the thumbs up button. Hit that subscribe button so you see more of our content and get notified. Okay, random hair tip time. If you've got thinning hair or hair loss, consider cutting your hair shorter. A lot of people think that long hair will hide areas of thinning, but long hair is heavier and it pulls your hair apart at their roots and it can actually reveal scalp underneath. Areas of thick, long hair can actually highlight the contrast between those areas and areas of hair thinning, making it more obvious. So consider cutting that hair. If you think you might be interested in minoxidil or any other kind of hair restoration option, stay tuned right to the end. I'll throw up the contact information. Get in touch with us. I'm happy to talk to you.